1. Mr. Speaker, ladies and gentlemen, over the past 50 years in modern medical technology, the biggest killers of people, regardless if you're poor, middle class, or rich, happen to be things like coronary heart disease that lead to things like cardiac arrest, stroke, and heart attack, or cancer, of which is really questionable in terms of how we're really able to treat. In fact, cancer is kind of this hodgepodge word wherein we say certain cells are eating each other and starting to attack other cells, and as a consequence, wreck those good cells. It's largely questionable and unexplored, especially in its early stages. That is to say, in as much as doctors can say shit like, hey bro, the true prevention is exercise, sleeping 8 hours, drinking water, eating healthy, or touching some grass. People either don't give a shit because they're young and they have a hyperbolic discounting, or if they're the urban poor or middle class, of which we say this debate is primarily about because of publicly funded healthcare, they don't know any better, and even if they did, because of their lifestyle choices and limited capacities, they place themselves at a disproportionate risk to these particular conditions because of unsanitary lifestyle choices, them having poor diets, and even all of that stress on their heart because of having to work hard in the rat race given their desperate circumstances. Couple of features of this debate that's important. Number one, this debate is not necessarily about what is better, prevention or cure, but this debate is uniquely about the tipping point and the consequence of priority. On-site government, we rather prioritize diagnostics and disease detection at the expense of like late-stage treatment because protection or prevention, which is a function of being able to diagnose and actually understand that disease in the first place, in and of itself allows our ability to be able to reverse it and change it through lifestyle choices or direct medical intervention. That is as opposed to opposition counterfactual, which is okay, we're gonna have more late stage treatment, and ultimately that is where a lot of harms and a lot of complications come in at the point in which it's more severe, making it even more difficult even if you have more information. Kumbaga, stage 4 cancer, even if you dedicate more doctors, more personnel, and more equipment, is just fucking harder to deal with as opposed to diagnostics, which can unlock maybe the more early stage acute nuances of such. The next part of framing is that this debate is about the allocation of resources, meaning what we're referring to prioritize is every particular extra dollar, personnel, or equipment, we're gonna skew towards being able to understand how these things work in terms of research to be able to unlock it, especially with things like cancer, especially in late stage. Make no mistake, right? I don't want the other side to be like, oh, Joseph, fuck you. You won't have anyone operating. You won't have anyone dealing with late stage. We're still going to have late stage treatment, obviously, because you're going to have some people falling on that side of the spectrum. But in terms of prioritizing the resources we have now, especially since we're aware already of a lot of late stage complication, a lot of preventive mechanisms happen to be uncertain and really expensive at the point in which it's so complex. But what we do know is the point in which it becomes late stage, it gets more delix. Yeah, Carlos, go for it.
If a patient with cancer is diagnosed in a public hospital but there's no funding for chemotherapy, do you believe that knowledge makes them better off on your side of the house?
Yeah, because the ability to diagnose it, especially at an earlier stage, of which we can assume happens when you're able to diagnose better, allows us to even reach that stage before having to get chemotherapy or radiation. That is to say, through the levers of technology that allow us to be able to detect it before it starts spreading at the point in which you need surgery or you need intervention is exactly what we want to avoid. But of course, I'll be charitable, right? Meaning, you can't say, hey, cancer, hanggang stage 1 ka lang, ha? So of course, more people on our side are gonna be aware of it, and people might fucking freak out, meaning some people will realize, especially because these don't have symptoms, they're diagnosed late stage. Then we're still gonna have to do those particular treatment, which we think is already enough in status quo, meaning radiotherapy and chemotherapy are working, but the specific nature of what makes these cancer cells malignant and attack each other is the uncertainty, of which we think we get more clarity at our side. What have I been arguing, right? I've basically been arguing to you a couple of things. Number one, why should publicly funded healthcare have to prioritize diagnostics and disease detection? Number two, on average, how do we help more people? And number three, how do we reduce fatality or mortality rates? Basically, bro, this debate is a spectrum. On one side, let's say the left side, you have diagnostics and prevention, early stage. You have the middle, wherein fair game, you can fix it or not fix it. And then the right side, you have treatment already wherein you're cooked. That's where the radiation therapy and chemotherapy and a lot of these like late stage surgeries happen, which we understand in status quo are already accessible, but it's not about making these things more accessible, because if we can skew people towards the left or the middle to the left at the point in which we're able to diagnose, hey, you have a lump in your breast, oh shit, that's not just a pimple, that's something that you have to be able to deal with, actually make it more accessible. So what diagnostics and prevention really look like are exams, equipment, and capacities to allow people to really check themselves, because the intuition pump I have is simple. Sure, we have a lot of these like free medical exams and it's even mandated in schools and in work. But bro, do we really take those things seriously? To what extent do we do? The point in which we're able to package things in a more convenient way, like a smartwatch, for instance, that was developed to be able to check if you have arrhythmia, to be able to understand, oh my gosh, I could be potentially having a heart condition over the next few weeks because of my high blood pressure, which by the way is symptomless, allow us to be able to check in and rein in on these capacities to make it more aware for people so that they can do something about it. Yes, this debate is primarily about resource allocation and capacity to make things better. We are very proud to open this debate and stand on side proposition.